This is the new device that we are going to use for sciatic nerve glides. It's just going to be a lot more comfortable for the patient. Assume that Norma is set up in the traction machine, and let's say that we want to do her right lower extremity. You'll see that this goes around the foot, and this is the slide adjustment to make the handle length appropriate so that the person is comfortable. So first of all, you would put this around the foot, and there is a Velcro adjustment here to make it nice and snug. And then from here, she's going to have two handles. You try to guess the length first, but plan on having to make fine-tune adjustments. So that's going to be your right side. This is going to be your left side. So you basically, in the start position, you want them to not have to stretch too far, but if these handles are elongated too long, then she's going to run out of room to stretch. So from what I see right here, this could actually be shortened slightly. So I'm just going to slide this buckle, and I'll have you let go of that for just a second. I'm going to slide this buckle up like that. So as this gets closer to the handle, you can see that that's longer, and then I'm going to slide the other way. You have to experiment with this on your own. As I slide it this way, the length gets shorter, and then you may have to slide it for a final adjustment. So that should feel slightly shorter than what it was before. When the machine is pulling on your spine, that's when you're going to pull with your hands, lift up into a stretch position, and see how you're getting a little bit trapped there. You can have your hands further apart, make it comfortable for yourself, and you can even kind of squeeze the shoulder blades together, but just getting a nice pull. And again, if you see them getting too trapped, then all we do is just slide this buckle down a little bit more. So I'm just going to do that, okay, and then pull from there. There you go. And see how now you have more of a pulling angle, or it's going to be a little bit more comfortable. So this is the most comfortable way to do it. If you want to do a true sciatic nerve glide, I'm going to get this out from underneath you for just a second, Norma. Bend your knees. Now you wouldn't want to do this with a patient the way I just took that out, but just for illustration purposes, a true sciatic nerve glide would be having this lower extremity straight like that, and then your right one would actually start in the straight position, but that's just too awkward. So I like putting this half bolster underneath it. And again, this is going to be a more pure stretch, more classical nerve glide with this other leg straight. It's just sometimes the belt isn't quite as comfortable. So it's kind of patient preference. This setup would be the most consistent with a nerve glide. Sometimes I'll use the bench just because it's a little bit more comfortable. What do you think of
I like this one better.
Yeah, and this would be, if we truly want to do a nerve glide, this would be the one that's more consistent with a sciatic nerve glide. And then you go back down like that. How do the handles feel there? Okay. And then, to take it off, you basically just go from here, lift off. But remember, before it goes on to the next patient, you want to elongate this because next person might have a little bigger shoe. So always start with this in a more open position. Okay, good deal.